does.
Afternoon, I guess.
Sorry, Mike. It was.
Okay,
I'm
so,
gonna have to find some other shirt. You can. Or get a big arrow. Chair is
Say hi
here.
to everybody.
Hey, Marcia.
Yes,
What a cutie pie, Marcia.
thank you.
What's your name?
His name is,
Donovan. Good.
yes,
Should I
Donovan. And
whistle
he
and get him
can't,
started?
he can't really see you because he was poisoned, and so he's got very, very fragile vision.
Oh, that's horrible. Sorry.
But he's great fun, and he's just as sweet as can be. He's two.
Good.
Two,
You still got
yes.
plenty of energy then.
Yeah, abundant energy.
The dogs are truly, the
But
dogs are truly.
I know, aren't they wonderful? What would we do without them? There. You've got one too, don't you?
Well, I'm in.
so Chair, I'm gonna mute everybody and then just try to figure out the board members.
Okay.
Yeah, so since the board members can unmute themselves once they're ready to speak. So we are ready.
You ready?
Yes.
Good afternoon, everybody. This is Thursday, August 27th, 2020, in the middle of our fun COVID pandemic. This is the Washoe County District Board of Health meeting. We will begin today with a roll call and determination of quorum. Susie?
Yes, Chair. Dr. Novak,
Here?
Michael Brown,
Here.
Commissioner Burkbigler,
She's here.
Councilman Dare,
He's on the phone.
yeah, we know he is, but he's not unmuting himself. Dr. Danko, Councilman Delgado,
Oscar's on the phone. Can you
yeah, he is. They
unmute
just-
everybody right now?
They just don't, they haven't unmuted themselves, so I had to find them and unmute them.
Tom Young's here.
Yeah, I just wanna. I'm gonna try again with the attendance, Chair.
Okay.
Dr. Novak,
Here?
Michael Brown,
Here.
Commissioner Burpigler, Commissioner Councilman Dare, they're just not unmuting themselves. Yeah, they're not,
Can you unmute the whole group? If you can hear me, I'm sorry, we're having a few technical problems we're working with, so if you can hear me, wave your hand. I can see that.
This is Oscar Delgado. I'm on.
there, he's there.
Thank you.
Can we ask, because I know Dr. Denko is on, and if she just,
Oscar, are you hearing us? There's a problem with are we muted?
let me look. Let me go look at the main computer, hold on.
Can anybody hear us?
Yes, I can hear you.
We can hear you now.
Oh, good, thank you. We're gonna try roll call one more time, please. So if you can't do it, respond, hit your space bar if you could, please, because that'll unmute you.
Thank you, Chair. Dr. Novak,
Here?
Michael Brown. Here. Commissioner Burpigler,
She's someplace.
yeah. Councilman Dare,
He's still muted.
Dr. Denko, Councilman Delgado,
Miss Susie, can you run it, your meeting from over there?
they can hear me, they're just not unmuting themselves.
Maybe they can't unmute themselves.
It gives them a notice to,
Because it still shows that Chris and Alexa,
Yeah, I think they all know how to unmute. I think it could be that we got unmuted.
yeah, I saw Dr. Denko's message too. Tom Young is unmuted.
Yeah, Christopher's messaging me that he's here.
we're getting messages at the bottom of the page.
Yeah. It's Dean Dow, and he says that it's shown on their screens that we have them muted. We have control of their being muted.
Can you unmute from the other station?
Let me see. He should be able to do it from here, but I'm not, let me see. Okay. Can you check with them, please?
Can you try talking through Zoom, Dean? You still getting that message?
Okay, I'm unmuted now.
Are you unmuted now? I just got Marcia back.
Marcia, you still there?
Yeah, I'm here.
Were you getting a muted screen?
Yeah, I could hear you, but you couldn't hear me because it said that the host has me muted.
Okay, that's what we're trying to unmute everybody now. There you are. Hi.
Could they not, could Councilman Dare not?
I've got Dean down.
Okay.
How about you, Christopher? Can you hear us now?
Dr. Danko, are you unmuted?
Just that on his side, it doesn't show anyone in the meeting.
Marcia, are you still there?
I am, I'm right here.
Okay. Your only one is live. We'll try to get the rest set up.
Can we ask everybody to just like get back in? Cause it's just, I'm not, it's not, they're not muted here, so I'm not really sure what happened to their sound.
Your help's behind you.
Dean, can you try talking again, unmuting yourself?
Can everybody that's signed in try unmuting yourself on your screen, please?
Works for me, thank you.
It
Okay,
just worked for me.
okay, we got two of them.
Just work for me, Naomi.
All right, thank you.
This is Rika Danko. Can you hear me now?
Gotcha. Thank you, ma'am.
Thanks, Steve.
Woo, about time.
Yeah. Well, I'm glad, sorry you guys missed the rest of the meeting. Anybody else want to talk? Okay, we're
Can you hear me
gonna,
now? This is Chris.
yes, Chris, gotcha.
This is Christopher.
Okay, one more time, we're gonna do the roll call for quorum.
Sorry about that, Chair.
Is the DBOH the division of the Board of Health or the Department of the Board of Health?
It's the District Board of Health.
District.
Okay. Dr. Novak?
Here?
Michael Brown? Here. Commissioner Burt Bigler?
Here?
Councilman Dare?
Here.
Dr. Danko?
Here.
Councilman Delgado?
Here.
And Tom Young?
Here.
Chair, we have a quorum.
Good. Thank you. Ms. Reed, can you lead us in the pledge today?
Yes.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, next item on the agenda is public comment. If you're going to make public comment, please state your name and who you are representing. So, Susie, first.
Yes, Chair, we have Tom Dunn.
Mr. Dunn. Mr. Dunn, are you there?
Yes, I'm here.
Okay, you're on for 3 minutes, sir.
All right, good afternoon. For the record, Tom Dunn, representing the Reno Firefighters Association, and with me in the room today is also a representative of the Truckee Meadows Firefighters Association. We're here today and speaking public comment in regards to the RIMSA EMS 911 emergency services delivery and the changes that went into effect on August 1st of 2020. On July 29th of 2020, RIMSA sent a letter to the partner agencies saying that there was going to be some 911 program delivery changes in regards to decreasing level of service, putting into service some ILS or BLS ambulances, and some other things that were discussed at the August 25th District Board of Health meeting. Looking at your meeting minutes from the July District Board of Health meeting, I don't see where a vote was taken to actually implement those program changes. Along with that, we believe that these changes had not been properly discussed with the partnering fire agencies and the EMS Advisory Committee, and therefore there's potentially a violation of both the REMSA franchise agreement as well as the interlocal agreement as well. This week on Tuesday, we sent an official letter to the City of Reno requesting a public meeting from the City of Reno, a public meeting with the District Board of Health, as well as a public meeting with the EMS Advisory Committee to discuss in public, for full transparency, these program changes for public discussion. And with that, I'll close my comments. Oh, along with that, I did send a copy of the letter to the board this afternoon to be added to my comments as well. Thank you.
Okay. Anything else? Thank you very much. Next.
We have no more comments.
No more comments? Okay, very good. Moving on from public comment at this point to approval of the agenda. You all received the agenda in your emails, had time to go through it. Is there any changes or corrections to the agenda? Hearing
Move
none.
approval.
Beg pardon?
I said move approval.
Okay, good.
Second?
Second, okay. For discussion, any discussion? If not, all in favor?
Aye.
Opposed? Opposed? Hearing none, that passes. We'll move on with the agenda. Next item on the agenda is recognition, and I am going to lead the recognition for a minute, which will be very obviously why. I want to congratulate Mr. Dick for 10 years of service. He was hired on August 30th, 2010, and now he knows what the meaning is to be the head of the health officer here. So it's been quite a ride the last couple months. So here is a certificate and his 10-year pin. So thank you, Mr. Dick. Now it's your turn.
All right. Thank you, Chair Novak, for that recognition. But for the next person I'd like to recognize, that almost seems insignificant. So I'd like everybody to make sure you're seated for this. We're recognizing today Denise Kona for 35 years of service with the Health District. She was hired on August 19th of 1985. She's office support specialist in EHS, assists with the permitting activities there, does a fantastic job for us. So
wow.
Congratulations to Denise. Also want to recognize James English for 20 years of service with the Health District. He was hired on May 15th of 2000. But his anniversary is August 14th of 2000, so I don't know what's up with that. He must have had some leave time off in there. And then Mr. Wesley Rubio, also with 10 years of service, hired August 16th with EHS Environmental Health Supervisor, as is James English. I want to also congratulate Dave Kelly for his promotion from a senior environmental health specialist to a supervisor in EHS. We have a couple of new hires in air quality. Matthew McCarthy, who started with us on August 17th as an air quality specialist trainee, and Candace Brown, who will be starting with us next Monday, also as an air quality specialist trainee. I also want to recognize and thank Alice Arpuckett for her service as an epidemiologist. She resigned effective the end of July from the Health District. And under the Shining Star program, I wanted to recognize Heather Homestead, who received the Tier 3 level with 3 Shining Stars for her service. And Heather was quite helpful for transferring over and assisting as an epidemiologist as we were working our way through some of the COVID response. So thanks to her for her efforts. And with that, I will conclude the recognitions. Would you like me to proceed with
Yes,
our
please do.
proclamation?
Please do.
All right, we have a proclamation today, and this is for International Overdose Awareness Day, and I believe that we have Brittany Wiley joining us via Zoom, who's a youth and community outreach specialist from Join Together Northern Nevada, JTNN, to virtually accept the proclamation. So I would read the proclamation. It's, as I said, International Overdose Awareness Day. Whereas International Overdose Awareness Day is recognized around the world as a day to acknowledge individual loss and family grief for people who have suffered an overdose. And whereas in 2018, there were 741 deaths from drug overdoses in Nevada and 67,744 in the United States. Whereas Overdose Awareness Day recognizes overdoses from legal and illicit drugs because it echoes the tragedy of the overdose crisis, allowing us to speak and educate more about the issue. And whereas Overdose Awareness Day raises awareness of and reduces the stigma of drug-related deaths and is an opportunity to honor those who lost their loved ones to an overdose. And whereas Overdose Awareness Day celebrates those who have survived an overdose, and whereas Overdose Awareness Day sends a strong message to support those suffering from a substance use disorder, to acknowledge they are loved and valued, and whereas Overdose Awareness Day will bring attention to the struggle of addiction in our community while making a commitment to preventing loss of life, and now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim August 31st, 2020, as International Overdose Awareness Day in Washoe County, Nevada, adopted this 27th day of August 2020. Dr. John Novak, Chair, Washoe County District Board of Health.
Good. Thank you. Need a proposal? Thank you. Thank you. Have a second?
Second, Rika.
Good, thank you. Any discussion? Hearing none, all in favor?
Aye.
Aye.
Opposed?
Aye.
Passed unanimously, thank you very much. Moving to item number 7, which is our consent agenda. It has been sent out. It was fairly lengthy with a number of pages. I am sure you read every word of all the documents, so is there any changes on the consent agenda?
Mr. Chair?
Yes.
I just would like to take a moment to acknowledge item C, the donation that we received from Nathan Almley, who had come through the post for testing and was very impressed with how well that was run and the efforts of staff. And he came back and provided 60 lunch vouchers for people, or gift cards for lunch for the people, staff, and the post. So I just wanted to acknowledge that on the agenda.
Thank you very much for bringing that to attention. That's a nice gift, and if you haven't been to the post, it really is a thing to see. It's really good and efficient. So moving on, does everybody accept it? This is our motion to accept the agenda.
Make a motion to accept consent items as presented.
Second?
Second.
Okay.
Second, Rika Tanko.
Okay, all in favor?
Aye.
Aye.
Opposed?
Aye.
Hearing none, moving right along. Thank you very much. Okay, this is item number 8, which is the presentation on Truckee Meadows COVID threat meter. Mr. Smith?
Thank you, Mr. Chair. This is Jeremy Smith, the Director of Truckee Meadows Regional Planning Agency. For the record, I'm joined today by Councilwoman Naomi Dewar, who's also been participating in this effort. If possible here, I'm going to try and share my screen. I have a short PowerPoint to show you guys about our COVID threat meter.
Hey, Jeremy, could I just make a few introductory comments?
Please do, absolutely.
Okay. All right. For those of you who don't know, some months ago, Mayor Hillary Sheevey convened a COVID task force. And in fact, one of your members, Dean Dow, was designated as the vice chair of that effort. Over time, the group grew as the needs changed, and over time, an idea developed to develop a COVID threat meter that was unique to our community to help us plan and manage the pandemic in a more sustainable way, and also to give people more individual understanding and an opportunity to take action specific to them. Again, the group continued to grow, and it led up to a meeting this Monday evening where Jeremy, who I had brought on board to this task force, he's now director of the Truckee Meadows Regional Planning Agency, and I am the chair of that same organization. He, with his techniques and some of his staff help, put together a proposed threat meter. We reached out to experts from Harvard, from New York, from MIT, from the RAND Corporation, to really analyze data that's being used nationally and to bring that expertise in here to Reno. So this Monday, we were joined by a number of doctors who had not participated, the head of all 3 hospitals, Northern Nevada Medical, Renown, and St. Mary's. We were joined by members of the school board, which included Katie Holland, Angie Taylor, and Dr. McNeil. And we were joined by Kevin Dick and some other members of your health district. People seemed pretty happy with where we were going. And so the idea was to try to meet with a number of groups, roll out the concept, share the details with you, talk about how this could be used to help our community. And I got to say that the aggregate on the call on Monday night was totally phenomenal. I actually ended up doing the introductions for everyone. Of the 25 people, I would say 20, including Dr. Jeremy Smith, are either have their MD, their PhD, in some form or fashion. So there's only a few of us, in fact, at this point that don't. So we've tried to bring some of the best minds and best practitioners in our community together, the leaders, people on the front lines, to talk about this issue. So thank you for providing time on your agenda today. We wanted to start with you. You are the key cog in helping us manage COVID, obviously. You're where the action happens, where decisions are made. You've been managing it every single day, growing your organization. So with that, I'll turn it over to Dr. Smith, and he can tell you what we've got so far. And the goal here is to get any input you want. What we'd like to do, and within a week or two, pending final sign-off sort of on this group, we'd like to roll this out for the community and see where it can be helpful, not to replace what you're doing, but as an adjunct to what you're doing. And if it feels right and it's working, it may in fact become a way that we can communicate. And since we have a number of firefighters on this group on today, we've really been trying to model it on, in some regards, like the fire threat, the danger, the red flag warnings, the same that we do with flooding, the same that we do with pollution counts, pollen counts, UV counts, but those are a little simpler. This is a little more complex, and that's why it takes Dr. Smith to really put it together in a statistically significant way and make it explainable. So with that, again, I'll turn it over to Dr. Smith. Thank you.
Thank you very much. That actually helps. It was a great introduction and helps me because I won't have to cover that part. So thanks. We can get right into it. I'm going to try and share the screen here. Okay. Okay, so hopefully you guys now are seeing a full screen presentation. Is that true? Excellent.
Yes.
All right.
Yes.
Well, this is the kind of the homepage look of the Truckee Meadows COVID threat meter. As Councilwoman Dewar explained, this has kind of grown out of that task force that was started by Mayor Sheevy. You can take a look at a draft of the site that's up on the web here at the URL that's at the bottom. But in its most basic sense, it's designed to be a simple tool, for citizens to quickly ascertain what is the current threat level or current sort of escalation level of COVID in the community, and that is based on data trends. And then along with the designation, moderate, high, very high, that sort of thing, there goes along a set of guidelines to help empower residents to make decisions about their behavior that are in line with the threat based on looking at the data. So it's a fairly simple upfront approach in the beginning. You can dig in on the website and learn more about each of the data indicators, and I'm actually going to go through that now in some of the modeling. Not too much to talk about here because Naomi did such a great job of introducing us, but I would just say that we also have a councilman to hear from the City of Sparks who's participating on the task force. I know he's been maybe speaking about this to this group to some degree. And from that larger task force, we sort of peeled off a subcommittee of folks to work on the code of the threat meter. So it's not just myself. It included Dr. Eric Nielsen. He's an ER doc here in town. He's been fairly outspoken on social media and in the paper about the COVID pandemic. Dr. Ron Ariel, he's a pediatrician and has a long history of working on computer codes for what he called biosurveillance, which was a really cool term. So he has a history in working on stuff like this. Jack Hester is a grad student at Brown, and he's working on a public health degree there. He's been instrumental in helping us to do all the web programming to get this thing, to be as easy as possible to update daily via the web. Shawnee Sousa is the member of staff team RPA that has put the website together and has a really cool eye for graphics. And then, of course, Councilwoman Dewar is here. She's the big picture person and keeps us connected and sort of helps keep things moving. And then myself, I sort of have data handling and coding modeling skills, so I've been able to bring that to bear, and folks might ask, Truckee Meadows Regional Planning Agency, we're really involved in land use, but of course, this is an unprecedented event across the globe. And so, these sort of extraordinary times, I think, call for extraordinary action. So we are happy to step up and try to lend our expertise to move this along. Just in terms of the 4 colors, we have these pieces of advice right now for folks. The green is minimal to no COVID-19 activity. Really tough, you'll see in a sec, to reach that with the data that's out there in our model, but hopefully that's the goal, right, we're heading for. In terms of yellow, it's just basically a moderate level. Obviously, we want to continue to think about wearing masks and following protocols, but it's probably the least restrictive of the guidelines we propose. Obviously, orange, things start to escalate, and the advice is to basically isolate as much as possible. And then if we get to red, which we had one time around July 4th that the model actually did hit red, potentially that's sort of really crisis mode, and shutdowns could be a thing if we have a sustained red condition. So anytime, every day, we're collecting the data daily. It's a pretty quick process now, and the threat meter gets updated every day. Even though we haven't formally launched this meter yet, we're still keeping it up to date. So we really kind of boiled it down. We started with more metrics, and we kind of had to go through a heuristic process to boil it down to what was sort of the 5 things that we thought mattered the most to talk about this threat meter. So we have 5 data indicators, and I'm going to go through each one, but just briefly, we're looking at risk assessments. So thanks to help from Kevin Dick and Heather Kerwin here at the Health District, we were able to get an accounting of how many people are calling in or on the internet trying to get a test, right, to see if they have COVID. So that's sort of a leading indicator, and you'll notice that these 5 indicators kind of span the spectrum of time of a given COVID case, if you will. And then the second data indicator is COVID test positivity. We can have a bit of a discussion about this metric. It's sort of it's been a tough one for us to pin down, but I think we're on the right track, and we'll talk more about that. Daily new cases, obviously, as cases increase, that's an indication that things are escalating. If they're decreasing, that's what we're after. Medical interventions, this is specifically about how many folks are being hospitalized because they have COVID, and how many folks are being put into an ICU bed because they have COVID. And that's kind of a measure of the severity of how the disease is affecting our residents. And finally, hospital capacity. Early on, there was quite a bit of discussion about flattening the curve and making sure that we had hospital capacity. I will say just quickly that our region in the north of Nevada here has been very good about keeping hospital capacity available. Each of these data indicators in the model can generate a score of 0 to 3. So it's kind of an additive model, with the highest possible model score equal to 15. And the way we do that is right here. You can see all the 5 indicators going across there, the score is going down the left side. And then, for example, let's take indicator 2, test positivity. If we look at a 7-day average of test positivity, we're using the World Health Organization guideline of 5% as sort of the 0 score position. From 5 to 10, you would generate a point. If test positivity that day was from 10 to 20, that'd be 2 points, and so on and so forth. With indicators 1 and 4, we're really looking at trends. Are medical interventions going up or down? Are people calling in to get tests scheduled or risk assessments? Is that going up or down? In terms of the new daily cases per 100,000, we took these breaks. This is a really useful metric, that middle one, because it allows us to compare ourselves to other communities, because it's normalized by population. But also it's been vetted by Harvard came up with these breaks, and we feel like they're a pretty good indication of, tracking different levels of case escalation in the community. And finally, indicator 5 is about the availability of hospital beds and ICU beds. And those are some fairly standard cutoffs per the medical professionals on our team. All right, we also have been considering how to implement the known effects of holidays and special days and an increase in gatherings, which we know can lead to the spread or heightened spread of the disease. And so at this point, we've been adding in a point where you see orange dots along the calendar to the model score. We're not sure we're going to stick with that. We're working through this, but one of the things we know is, Labor Day is coming up. Folks are going to have barbecues. There's going to be gatherings. We're hoping to get this thing launched before that, and I think really message that we need to be super careful about what we're doing on the holidays to keep our community as safe as possible. So in process, but we are trying to account for the known impacts of holidays and gatherings. So here's the last 45 days or so, or a couple days out, I think this goes to the 23rd of August, of model scores. And what you can see here is that looking at all those thresholds and breaks and looking at the data, here's how the scores added up. And back on the 2nd of July, given our special day assignment, we actually did breach for 1 day into the red. But good news is that for most of the period of recent history here, we've been either in the yellow, which is where we hope to be, I think, or in the lower orange spectrum. So we're moving along pretty good, but this is kind of how the model goes. And you can see on the right where we draw the breaks in terms of the score. So very difficult to get to green, also pretty difficult to get to yellow, and then, the orange condition, getting up to 10 points to get to red. Like I say, it happened just that one time. Okay, so now I'd like to go through individual data graphs showing the 5 indicators. And I'll explain how indicators 4 and 5 actually have 2 pieces of information coming in. It's kind of neat. This first one is risk assessment data. This is a portion of all of the folks out there that are seeking to get a test for COVID. And it's a bit variable, right? That black line represents the number of risk assessments received daily at the health district. And so we're actually looking at a 14-day slope of this to kind of tell whether or not risk assessments are trending up or down. And similar to kind of visualize it, I put a blue dashed line on there that represents a 14-day moving average. And you can see that in a pretty good way that risk assessments to some degree have been decreasing. And that's really the leading indicator. I mean, that's the first inclination of data that we have that the spread of COVID is increasing. If tons of people are calling in to get tested, and if they're symptomatic, then that's that indication. We want to be aware of that initial increase. Second, we have a concept of test positivity. So test positivity is really just the percent of tests that come back with a positive result based on the total number of tests administered. We have been kind of going back and forth and working through this metric. Naomi and I have a meeting in the morning with state biostatistician to understand how they're calculating test positivity. But, and I've talked with Kevin Dick and Heather Kerwin at the health district about what's the best way to do this. And ideally, you would be able to link specifically a patient that got a test on a certain day, they got results, it was positive or negative, and relate that back to get the cleanest measure of test positivity. For our meter, we're trying to update this daily. And so we're looking for a consistent and reliable source of data, which right now we're pulling this off the Department of Health and Human Services, the state site, which talks about the number of tests administered. We're kind of subtracting to get each day, and also the number of people tested. So it's interesting, if you look at the number of people tested, right, the test positivity rate goes up quite a bit because sometimes folks will be tested multiple times and they may have many negative tests. And so it's important that we consider this, and we won't be able to talk after the presentation about your folks' thoughts on test positivity. But we're still working to refine this. You can see it's been going up to some degree in the past few days. Daily new cases per 100,000 people. You can see the trend here, and this is a 7-day average of that, so it's been normalized. Good news, kind of heading down. So, or at least holding stable from some peaks that happened earlier last month and in June. Let's see here. Okay, so now we're into the Nevada Hospital Association data. We've been fortunate to be connected with Chris Lake over there. He's, I think, pretty high up at the Nevada Hospital Association. All of the hospitals every day report this information to NHA, and then they publish a report that we've been given access to, and we're using that data. So this is specifically showing a 7-day average line of how many folks have been hospitalized due to COVID, and luckily you can see that that's trending down. Likewise, in that indicator, we also take a look at ICU bed use, because that's obviously an important indication of how severe a given case is. And there's different considerations once you get into the ICU, but luckily also going down in recent past, so that's good. And finally, we have some information about the hospital capacity. So what we're looking at here is total hospital bed use. That dramatic downturn that you see around the 22nd of July, to some degree, is a reflection of how the data are being reported. Initially, we were looking at staffed beds. Now NHA is looking at licensed beds, and so that increases the number of overall beds and helps kind of indicate that we do have quite a bit of capacity. I will say this does not include the renowned garage surge bed capacity, but we're aware of that, and if that does become an issue, we'll be able to take a look at that data as well. But good news in general is that we're holding pretty stable in terms of total hospital bed use. Now, this is not just COVID, this is everything. What it's indicating is that we're somewhere below 65% of capacity. So we have quite a bit of capacity to swell if things escalate. Likewise, total ICU bed use, I believe there's around 257 ICU beds in the North region, and we're currently using well under 50% of those. So we have good ICU bed capacity. As we move into the fall, I know there's been concerns about the kind of effects that flu might also bring to bear on our hospital capacity. So we're tracking that information. So that's the data we're using, and that data is available on the website for the COVID threat meter as well for each day. Some considerations and next steps, really, that as you can see, it's not perfect data. Data never is perfect, but this again is kind of an unprecedented thing, and folks have been working really hard to get this stuff together. So we anticipate there will be ongoing refinements to the model. Testing accuracy, I'm working with Jack Hester to do some of that, looking at codependence of these variables, and if we can tease out some predictive power as well. Another concept would be, rather than just having green, yellow, orange, red, could we have like a low orange or a high orange? Folks might be more empowered as residents if they knew that we're right on the edge of going to red. We're not just in orange, it's like it's trending close to red, so be aware. And then finally, what today is going to be great is to get some feedback from folks. You can always email me, jsmith@tmrpa.org, with your feedback if you don't feel like talking today. But trying to build in information. We had that great meeting that Councilwoman Dewar mentioned on Monday night, and we got tons of good feedback. So we'll be working some of those refinements in as well. And then finally, I think we know that there are several versions of COVID metrics out there. The state has proposed some in terms of reopening strategies. The school district is working through metrics in terms of keeping the schools open or closed. There's national metrics, right? The university has certain considerations as well. And so we want to make sure that, we're not trying to say everyone should use this as the primary source through which they will make these decisions. However, it is a secondary kind of independent check that's based on data trends that can help them to understand if the metrics they've been creating, are in alignment with what we're saying or not. And we can always have the discussion. So we're definitely here to help have that conversation. But this tool is really designed initially to be a communication device to the community and to empower residents to make behavioral changes in their own life that they think are appropriate based on what's going on with COVID. So with that, I'm happy to answer any questions, and I appreciate your time today listening to that talk.
Do we have any questions from the board? Comments?
Jason, or Jeremy, you might want to stop sharing your screen.
Got it. Thank you.
Any questions, comments?
This is Tom Young. I would like to, I think it's such a dynamic situations we're going through and trying to understand, how to respond in the future. And I would like to somehow also wonder where we're at with some of the antibody testing and see how this whole community is doing in terms of overall infection rates at one time too, although that might be stretching it a little bit in the science, because the science is tough enough as it is already.
Good.
That's a fantastic comment. I think in tomorrow's conversation we have with the state biostatistician, I can bring up and find out what the availability of that data is.
Any other questions? I have a few comments. I'd like to know, how are you going to release this information? To who? When? Is it daily? Is it on your website? Does it go to the public?
Yes, absolutely. Great question. So yeah, the idea is to run the model daily, and the model runs in about 30 seconds. And it takes about 15 minutes to collect all of the data streams and get it into the data matrix and get it going. So realistically, our threat meter is always kind of a day behind because of how these data are reported.
Sure.
So I received the hospital. Yeah, but it's a daily thing, and it's a website currently being hosted at the tmrpa.org site. It's tmrpa.org/COVID-WC, and that's actually at the beginning of the presentation. And you can happy to share that in an email. But yeah, it will be updated daily. We're working on a Spanish language version as well, and it will just be something that folks can go check. And I think when we're ready to go, we're planning to have a press release. Planning to point people to it, and I think we can also consider partnering with like the RGJ or whoever to like the burn code metric to get this in a way that's very accessible to folks.
Okay.
And if I may answer, sir, I would just add that I think that Mayor's hope and dream is that we will have medical professionals at the front. We will do some kind of rollout that would be in a press conference. I think that her idea is that just as the fire chiefs and the fire personnel are the ones we look to get fire information, or REMSA if it's an emergency type situation. In this case, some of the doctors that we've been working with are willing to sort of be the public face of this. And again, they're from all different institutions and organizations. It's not just one organization. But what we didn't want to do was have this be a political thing. So we really wanted to have us politicians more in the background, because this is a science thing, it's a medical thing, and it's a direct communication with the community. I think the mayor's concept is maybe once a week. The doctors would step forward for 10 or 15 minutes, talk about the meter, where have we been last week, what is next week looking like, and make that information available to all the media. So if they choose to share that. One of the things Jeremy's also done is to link to all the data sources, just as you have on the health district. But he has done as comprehensive a linking as he possibly can, so that this meter could be shared outward onto your data set. As long as there's one central that's generating the information, it can be shared anywhere anybody wants to put a link, whether it's health district, whether it's Washoe County itself, whether it's any jurisdiction or any organization could have a link back to that. That's why it'd be very easy for a media outlet partner to do that as well. We mostly want to make this easy to understand. So many people have said, okay, I heard test positivity. Is that bad? I've heard the number of cases. Are we up or down? How do I, as a citizen, resident, someone with kids, interpret what is going on? It's been very difficult, and that's why the fire index is so well received and understood, I think, by our community. We really applaud, how well it's been used for 30 plus years. That was really the intent, is something super easy to get. And then you say, well, what does it mean if it's orange? What, am I supposed to do something different? It was yellow. And so we have a layering, and you'll see on the website of, you start with masks, and then you add social distancing, you add the smaller groups, and you restrict gatherings, you know, as the meter goes up. And so it's just a layering effect. And people make choices, right? And there's also mandates in there, whether it's from the governor level, state level, or our local levels.
Good. Thank you very much, because that answers one of my questions. Well, actually, two. I do like the fact it's going to be based in science. That's where the front's going to be, the face of it, not coming from the government or the politicians. I think that's very, very critical to do that. And the fact you brought up, that there's going to be a layering. If you click on green, it's not going to say much, but by the time you click on the high levels of orange, it's going to tell you what to do. And I think that is critical. I do want to, on a personal level, it really extend, you guys have done a lot of work. I love the grafting that you've done. It's very easy to understand. So I think this group has done a great job. I'm looking forward to having it. Just please make sure that before you release it, that you talk to Mr. Dick or somebody at the health department to make sure we're both messaging the same thing. And I think that's critical to everybody, is the message is the same all the way down the line. And that's what we've done with the JIC as much as we can. So sorry to take up so much.
Well, you're hitting on a critical point, because our goal is to reduce confusion, not add to the confusion.
Thank you.
And that is why we got the school district involved, because there've been, even today, and I don't know how to say this, quote my out loud voice, but even today what I've read is that technically they maybe aren't meeting their own numbers that they've set for opening and closing. And maybe they're not meeting governor's numbers that have been set for bars and restaurants reopening and closing. And so they're looking to some kind of centralized data that they can say, okay, this tells us the answer. But we are not at this point saying, you know, abandon what you're already using, except this. And you are so right in terms of everyone's got to agree, or just use it as an ancillary measure. Good. You know, either we're all together, and that's our goal, is to be all together in this. But if people have a discomfort, they can also add a layer of detail. So you might have this very simplistic model, but within that, maybe the school district has extra metrics that they're looking at. Maybe a casino or other group has different metrics that they're looking at. So, you know, we're not trying to be, you know, all things, all people. We are trying to be a one-stop shop, but we need the sign off. And what Mayor Chivi's asked is, by I think the next meeting, which is next Tuesday, people will have had over a week to look at this, study it, bombard Dr. Smith with questions about it, delve into the details if they want. And, you know, maybe by next Tuesday we get the go ahead, and maybe by next Friday we're doing a first press conference. I mean, it could happen that soon, but if we need to put on the brakes, we put on the brakes.
Thank you. And Dr. Smith, great job for chairing this. A lot of work. I appreciate it.
Thank you very much.
Thank you very much. Moving on to agenda item number 9, Regional Emergency Medical Service Authority. Mr. Dow.
Good afternoon, Chairman Novak and members of the board. My name is Dean Dow, President and CEO of REMSA and CareFly for the record. I would like to add that specifically to the issue of changes within the REMSA system and the rollout of that, fully recognize that approximately a month ago, my error, I thought I had done sufficient checking to make sure that I had things scheduled correctly, but obviously did not double check or triple check. So that's caused confusion moving forward. I think that we're trying to move through that confusion. We have a group working together every week on a Tuesday. And so I have to apologize to the board, our fire partners, et cetera, everyone on this call for the confusion that I created by trying to potentially, I guess, spin too many plates in this office all at one time. So with that, obviously all the board members have received a copy of the July compliance report for your review, and I am here to answer any questions if I can.
Any questions for Mr. Dow? Any comments? I'll take a motion to accept the report.
I move to accept the report.
Okay, first. Second?
Second, Rika Danko.
Okay, thank you very much. Any discussion? Hearing none, all in favor?
Aye.
Opposed? Okay, thank you, Mr. Dow.
Thank you.
Alexa, are you there?
I am, thank you. Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA for the record. You have for your review the Public Relations Report for July, and today I'll give you an update on a couple of our more recent activities. In early August, we recorded and shared a video that highlighted how emergency medical dispatch at REMSA works and what sets REMSA apart from other dispatch centers, which is, of course, the medical training that all of our dispatchers have. REMSA's medical director, Jenny Wilson, is the subject matter expert in the video. You can find it on remsahealth.com/news or on REMSA's YouTube channel. In August, REMSA launched a small social series called In the Wild Wednesdays, where people had to correctly identify the Nevada State Park. We showed them, and then they had the chance to win a gift card and a 71-piece first aid kit. These posts were followed up with a Minute with a Medic video posts where we shared safety tips for enjoying the wilderness in our region. We had great engagement, and the campaign wraps up this week. Finally, Adam Hines, Executive Director of Integrated Health, offered a presentation to the Reno-Sparks Chamber of Commerce, as well as a variety of media interviews about REMSA's response during the pandemic and our innovations and enhancements being made to the system. I'm available to answer any questions you may have about our public relations report.
Any questions, comments for? Hearing none, well, thank you very much. Appreciate that. Okay. We're moving along to presentations and approval of distribution of Washoe County EMS Oversight Program Fiscal Year Mid-Year Report. Thank you. Ms. Glenwa. Anastasia, are you muted?
Hi, everyone.
Hi there.
This is Anastasia Gunawan, EMS statistician for the record. Do you have any questions?
Do you have any additional comments, or just stay with your report?
Yes, so possible approval for the distribution of the Washoe County EMS Oversight Program, and this is for the 2020 mid-year data report and EMS agency performance.
Okay. Any questions for?
And I have no additional comments. Mm-hmm.
Thank you. Any questions, comments for?
I'll make a motion.
Okay. Motion by Mr. Brown. Second?
Second, Marcia.
Good, thank you. Any discussion? Hearing none. All in favor?
Aye.
Opposed? Good. Hearing none. Approved. Moving on to number 11. Ms. Albee. Charlene?
Can you hear me now?
Now we got you. Thank you.
Sorry about that. The mute, unmute keeps kicking in and out on me. So the item you have in front of you today is the discussion of possible adoption of Nevada Administrative Code 447E for the SARS regulations that came out of the SB4 special session. The report presents basically what has been presented in a summary of what's in SB4. Unfortunately, the state was not able to get the regulations adopted per their original schedule, which was intended to be on the 21st. We did receive the proposed regulations a couple of days ago. We're working on comments to get those submitted actually today. They're having a public hearing tomorrow, and the adoption of the regulations is not scheduled until Monday the 31st. So at this point, I don't believe that we'll be able to take any actions today under the guidance of our Deputy District Attorney. So we will, instead have to be coming back for a special meeting. One of the requirements of SB4 is that once the state adopts these regulations, the local health districts only have 14 days to adopt substantially similar regulations. So I'd be more than happy to answer any questions if there's any additional information you need at this point.
No, at this point, I'd entertain a motion to table this agenda item number 11 and refer it on to a special meeting that we will have to call of the board sometime, probably within the next 2 to 3 weeks. So I will entertain a motion that way.
Motion as stated by the chair.
Second?
Second.
Good. All in favor?
Aye.
Opposed? Good, carried. We will table that motion number 11, keep it for a special session. Okay, number 12, Ms. Albee again.
Yes, this is a item that we have had reoccurring, considering the late fees that Air Quality Management and Environmental Health Services have been having waived or extended as a result of our response to the COVID-19 economic impacts to our businesses in the community. This is, the third time I think that we've come back with this postponement. We're now proposing to push it out another 30 days until October the 12th, but we're also recommending that this be the final postponement of the assessment of the late fees or waiving of the late fees. The number of permits that we will be managing at some point when we do assess the late fees is getting to the point where it's almost becoming unmanageable. As the submittal of this report, Environmental Health Services has 358 late fees, each of which, when late fees finally do get assessed, will have to be touched manually to be able to get invoices out and take action. If people do not submit the permit fees, we will have to start taking some enforcement action, and that's a huge burden that's going to be put on an already tapped out staffing resource, especially in light of the SB4 rules that are coming down. So we are recommending and requesting the board go ahead and extend the waiver for 1 more month to October 12th of 2020. And I can ask or answer any questions that anybody might have.
Any questions from the board for Ms. Albee? If not, I'll take a motion to extend the hold off of fees until October the 12th.
So moved.
Second.
First and second. Any discussion? Hearing none, all in favor?
Aye.
Opposed? Motion carries. We'll hold the fees until October the 12th, at which time we'll reconsider our position. So down to number...
Thank you.
You're welcome. Thank you. Down to item number 12, staff reports and program updates. Mr. Vega.
Good afternoon, Mr. Chair. This is Daniel Inoue with Air Quality Management. Mr. Vega is currently providing public testimony in a meeting with California Air Resources Board, so I can provide the update for this month. Mr. Vega wanted me to highlight his director's report, specifically the program update and Nevada's Climate Action Plan, SB 254, and an executive order by the governor called for aggressive greenhouse gas reduction goals to the point where there will be 0 greenhouse gas emissions by 2050. Most of the low-hanging fruit is gone, so that leaves it up to the transportation sector. The plan to get to 0 greenhouse gas emissions aligns very nicely with our Ozone Advance program. So there are things that we would encourage especially our elected board members to help promote with their local jurisdictions to not only reduce greenhouse gas emissions, but also improve air quality, specifically our ozone emissions or ozone standard as well. We're highlighting certain things with Reno's Title 18 update, specifically Chapter 4, the development standards, and we're highlighting things related to growth concentrated in the urban core versus things in the Tier 2 or Tier 3 lands that have been identified in the regional plan, and just some general awareness of the environmental impacts of projects such as vehicle miles traveled is a better indicator than level of service when you're looking at traffic, or the tree canopy is a better indicator of the effectiveness of tree plantings as opposed to the number of trees. So those were the things that we wanted to highlight, and I'm available for any questions. Thank you.
Any questions for Mr. Renaway? Hearing none. I would like to ask, is there anything you can tell us about the smoke levels right now, what we've seen, where we might see it in the next 2 weeks or so? Daniel?
Yes, I had to unmute myself there. So with the latest wildfire smoke episodes, we did see some very, very high numbers with particulates and with ozone. That shows you just how vulnerable we are to being downwind to some of the largest wildfires in, well, California's history. And on top of that was not necessarily the total acres, but how fast those fires grew. They grew by tens of thousands of acres in a single day. So that generated a lot of smoke. And where we were situated, well, the smoke is going to go downwind. And last week we were downwind of many of the large wildfires. So right now, with the ozone exceedances that we monitored last week, there's a good chance that our design value will violate the ozone standard and possibly be designated non-attainment for the ozone standard. With PM 2.5, we did have some very, very high exceedances. We will have to crunch the numbers and evaluate that, and we will have that, I'll summarize that in the next Board of Health report for September. Thank you.
Thank you. Okay. Moving right along, Ms. Lottridge.
Hi, Lisa Lottridge, Division Director for Community and Clinical Health Services. I just wanted to add that our immunization team completed 4 back-to-school events in August, and they saw a total of 264 clients and gave 743 vaccinations at those 4 events.
Good.
And happy to answer any other questions about my report.
Any questions for? Okay, moving right along. Very good work. Thank you. Okay, Miss Albee.
Good afternoon, Charlene Albee again for the record. I did want to provide some additional information on the staff report regarding CBD oil. This is a pre-COVID topic that we had presented before the board. We do have an outstanding case with a hold order on food for Liv Kaya. I was contacted by their representative, Will Adler, earlier in the week, just confirming that the state did not get the CBD regulations finalized and approved as was their original intent by the end of June. They are still working on it. The special session threw them off, so they'll be continuing to work. He did want to confirm that we are still concerned about CBD. I did tell him that yes, we are, that we are still following FDA guidelines, and until those change, any changes in state law that would allow it for consumption cannot be approved by the health district. We are FDA grant funded, and we do follow their guidance and their rules. Another thing I wanted to point out is that we did have a staff member, Tyler Henderson, was just successful in passing his REHS exam. This is continues a streak of our trainees passing with 100% success rate following the completion of the formal training that was established. That was set up in 2016. So this has shown to be very successful, that we take in people who have the education to qualify as an environmental health specialist, and we train them, we give them full exposure to all the programs and make sure that they're prepared when they go in to take the test. It is about a 2-year process, and this is relevant today because of the extra burden that's being put on us for SB4. Even though the state is offering us $500,000 in funding through the end of the year, registered environmental health specialists are not available, typically out in industry for us to just hire to come in and work on the program. So as we get our trainees up and through, they're going to be very critical as we move forward to be able to meet our statutory requirements. And just wanted to acknowledge Tyler did a great job, and we actually have 5 more that will be coming down the pipe in the next few months.
Good.
And I'll be available to answer any questions.
Any questions from board members? Good. Thank you very much, ma'am. Okay. Ms. Epp.
Andrea S., Acting Division Director for Epidemiology and Public Health Preparedness. You have my report in front of you, and I welcome any questions that you may have.
Good. Any questions for? Hearing none, good. Thank you very much. Good report. Okay, moving along. I think this is going to be a little longer. Mr. Dick.
Thank you, Chair Novak. Wanted to begin on COVID-19. Is my mic on? Okay. Today, the state updated the county tracker that they're using for elevated disease transmission, and we are continuing to exceed 2 of the thresholds in Washoe County. We're meeting the requirement for average number of tests per day of 150 or more per 100,000, but our case rate per 100,000 is at 335.2, which exceeds the threshold of 200, and our test positivity rate, which is a 14-day average with a 7-day lag, is at 9.1%. So that's up slightly from where we were last week. So we're continuing to be flagged and are providing a weekly assessment to the state's task force. That was the most recent one was provided yesterday. The task force met this morning, and we provided an overview for them of our current capacity and our situation, and so we have adequate hospital capacity. We have adequate PPE. We have good testing capacity. What we've seen has been a decline of the number of people that are contacting us and coming through to get tested at our post, the point of screening and testing that we operate for drive-through testing over at the Reno Sparks Livestock Event Center. So while we have capacity for 525 tests per day there, we've been running it at about 300 per day that we're scheduled, and we have no-shows that come through for that. So this is also something that we've seen statewide, has been a reduction in the number of tests that are being conducted from a high that was occurring about mid-July to date. So, you know, as Dr. Smith identified as he was describing the COVID threat meter, this is one of the indicators that they're tracking, and I guess we're presuming that a lower demand for tests means that we don't have as many people that are symptomatic for COVID-19 in the community, but it's something we'll be watching and continue with. We are now using Charles River Labs for the analysis of the specimens we collect 2 days a week at the post, and they've been performing well for us with that responsibility. We're going to be looking to expand that to 3 days a week, a couple of weeks from now, if we continue with the plans. This weekend, the Acela Regional Permitting and Licensing Platform is going to be moving from one platform, an Oracle platform in the cloud, to an Azure platform for the servers they're using in the cloud, and that will cause the system to be down while they're making that transition from 5 o'clock on Friday until 5 a.m. on Monday. They may wrap it up sooner, but that's the window that they've got delineated. So we're asking anybody that wants to be tested, since we're using an Acela for the automation for our test scheduling, that risk assessment process, anybody that wants to be tested to go through the website portal or call the 328-2427 line prior to 3 p.m. on Friday, so that we can have the Acela platform available and be able to streamline and have that process automated. After that, once the Acela goes down, we will still be able to work with people for testing to get scheduled by calling our 328-2427 line. We'll have staffing over the weekend, 12 hours a day on Saturday and Sunday, but it'll be a manual process for working with them to get them scheduled for the post. We'll operate the post on Monday of next week. Then it'll be closed on Tuesday, and we'll resume on Wednesday, Thursday, and Friday. That will give us an opportunity to catch up with Acela coming back on and hopefully working properly on Monday to get people back queued up for testing on Wednesday of next week. So that's our testing schedule moving forward. We continue to work with increasing staffing for the disease investigation work for the people that test positive. We've got 58 disease investigators on staff now. We had some of the folks that were hired by UNR for our staffing that didn't work out as new employees, and so we do have some of those vacancies as well as additional staffing that we're working to fill, and that's going to be so we have 16 additional staff members that we want to be adding in September to cover that. We are contacting everybody with their positive test results within 24 hours of receiving those results, but then there is a delay before they have the disease investigators contacting them and doing that interview with them to identify the close contacts. But we're improving continuously in getting caught up with that. We are working with Deloitte now. They receive all of the line lists of those close contacts, and they do the follow-up contact to work with them on the quarantine. So I think that's most of the overview of where we're at. We did last week make the request to the state task force that we be allowed to have the bars open here in Washoe County once again. And the reason for that is we're continuing to see that we have outbreaks occurring from private gatherings. Those are one source of outbreaks, and the other are households where one family member gets sick and then the rest of the household gets sick. The private gatherings, we felt, might be diminished if people had an opportunity to get together at a bar versus going to somebody's private residence for a gathering. And that would be a controlled environment that government officials could enter, could inspect for compliance, could take enforcement action. The private gatherings are very, very difficult to have any control over. So that was the basis for that request. The state task force denied that request and took action to keep bars closed at this point, but said that they would reconsider that in 2 weeks' time, which would be next Thursday. So part of the work that we are doing regionally is also on enforcement. There were some concerns that were expressed regarding the level of enforcement and the level of coordination that was occurring with the state OSHA program on enforcement here. And so in the report that was submitted to the task force, we did provide, they had requested, and we provided additional detail on enforcement actions that are occurring. The cities are working to try to address the problem with private gatherings and some of the large house parties. They are dedicating staff to patrol in what they call party cars to try to police those events. And they're also stepping up inspections of businesses, not just responding to complaints, but getting out to inspect a portion of the businesses for compliance. So we're continuing to work to try to meet the task force's expectations, and we'll see how we can move forward in the future if we have an opportunity for them to reconsider the bar plan. We're working as well with the Washoe County leading an effort with the Regional Information Center, and some marketing firms have been brought on board. BVK is a national public relations firm based out of Milwaukee that has done work in this region, continues to, and they are partnering with our local KPS3 for this marketing campaign. They did an interview with some of our EPI team to get a better understanding of some of the issues that are occurring with people that they're working with, and to get a little bit more granularity of what they might want to be considering in some of the marketing and messaging campaign. And they're going to be doing a lot of concentration on our Latino community as the group that's disproportionately affected by this population. Anyway, about 40% of the cases there, as well as working on ways to reach that 20 to 40-year-old group that also seems to be out and about more and having more cases of COVID-19 proportionally in our community. So that's moving forward. I also wanted to address some of the comments. REMSA last month, as part of the COVID-19 response, identified difficulties that they were having with staffing levels, in part due to exposures requiring quarantine or positive cases. And so that was the basis under the Governor's Directive 11 that they had put forward for staffing some ILS and BLS ambulances for response in order to maintain ALS service for those priority calls that needed that level of care. There have been some concerns that have been expressed around that by our fire agencies per our interlocal agreement of them sharing data with us. I'm putting a letter out to the fire chiefs requesting for them to provide us with additional information about any occurrences that they're aware of, whether there may have been an inappropriate response, so we can investigate that and get down to any details of that through our regional EMS oversight program. So I think that's my overview on COVID-19. I did want to highlight some other stuff, but I don't know, Chair, if you wanted to open that up for any questions at this point, or you want me to keep going?
Is there any particular questions for Mr. Dick on COVID items? Okay. Go right ahead, sir.
All right. I think the other area that I wanted to touch on, I think we already kind of covered the SB4 items with Ms. Albee, but on the behavioral health front, Julia Ratty has worked with a FEMA grant and Human Services Agency to help bring on some resilience ambassadors that are basically crisis counselor type individuals that are now working with our EPI program to receive the positive cases so that they can follow up with those individuals to see how they're doing. Some people are doing just fine. Others are under considerable mental duress, and appreciate the counseling services that are provided through that team. So that's I think good progress that we're making there. I also wanted to mention some of the initiatives that are happening through Truckee Meadows Healthy Communities. The Truckee Meadows Healthy Communities had a family health festival. This is annually a back-to-school type of event that we have done. It's obviously becomes more complicated with the COVID-19 pandemic going on. So this was a drive-through event with mobile harvest and also several different partners, the Department of Welfare, School Districts Family Resource Centers, United Way, Catholic Charities, and the Health District, in addition to the Food Bank. And it was the most attended event with 1,500 people participating, and there were school supplies and books, et cetera, that were distributed and resource kits in addition to the food that was available from the food bank. And also the Build Health Project, which is to reach out and engage seniors, create social connections, reduce that social distancing. That's been complicated, of course, by the COVID-19 pandemic as well, but there are virtual meetings happening several times a week that they're doing via Zoom through the Hello Project. They have a website that they have just launched. They have some of the podcasts available from those meetings. They also worked with Art Town to do what is called the Heart Town Project, where they distributed wooden hearts and paints to seniors to be able to paint. And there are over 350 of those pieces of art that are displayed over at the Lear Theater on the fence through Labor Day. So we were pleased to see that people participated in that project, and we were able to have that installation done. So that concludes my report.
Well, thank you. Any other questions for Mr. Dick? As you can see, he's got lots of balls in the air at any one time, so thank you, sir. Next item is board comments. Do we have anything for future reports, requests for information, or agenda items? You guys out there? Hello?
I'm all good on my side.
Good. Thank you. I was just checking out there. Thank you very much. So I do have a few things myself, not in any particularly great order. If you have not seen the COVID Tracker Nevada, it goes on your phone. It's a very good new little item for an app that tells you if you're close to somebody that's tested positive. It does not give information that's individual to you or privacy information, but lets you know maybe you should be a little bit more careful. It's free on any of the app stores, it's COVID Tracker Nevada. If you do that, I want to acknowledge Denise Kona for 35 years. That's just quite an accomplishment, and thank you, lady. We appreciate it. Want to thank all the staff as usual for doing it, and especially the people in the post. I saw the whole operations the other day, and what an amazingly efficient operation. Thanks to the Guard for helping us, and the CERTS volunteers. Some of those people have been with us every day, and they guard their little golf carts for direction. Man, they're incredible out there. I do have an item that Susie's going to need signatures from each of the board members, and we'll get that out to everybody, so kind of keep track of your mail, and please sign it and just keep it going. Last two items, the flu shots are out there, and please urge everybody you know, get your flu shots early and often if you need them, but that's out there, please do. They didn't hurt too bad, and I did get a lollipop with mine the other day. And wear your mask, wash your hands, just the usual instructions. So we'll open it for public comment. Just to remind you, please state your name and who you represent. Ms. Susie.
Yes, we have Tom Dunn with the Reno Fires Association, followed by Chief Charlie Moore from Truckee Meadows Fire.
Mr. Dunn, you still with us?
Yes, I'm still here. With me here today is Chief Dennis Nolan from the Reno Fire Department. I believe he attempted to email the board yesterday that he wanted to speak in public comment. He's not sure whether or not his request to speak was put or not, so I'm willing to defer my time to him if that's acceptable.
Ms. Reed?
I'm sorry, are we waiting for an answer to that question?
Yes, we're waiting for an answer.
I don't discourage public comment in appropriate circumstances, and so there's.
It's okay?
I would argue that it's more appropriate to allow the comment.
Okay, thank you. Chief Nolan, go ahead.
Okay, for the record, hi, Chief Dennis Nolan with the Reno Fire Department, and I appreciate Mr. Dow's earlier comments, but I've been asked to read into the record the following statement for today. At the outset, this is not an attack on the management of REMSA, rather a report of observations on some very serious concerns of the recent response changes made by REMSA. At the last regularly scheduled meeting of the Washoe County District Board of Health, Dean Dow read into the record a letter which was shared with Chief Cochran only the day before the meeting. The letter outlined a number of substantive changes to REMSA's response and dispatch model. For the record, we firmly believe these changes were in violation of both the interlocal and REMSA's franchise agreements. These changes certainly on face value would have had a significant impact on Reno Fire Department's emergency medical response, and we offered objections to these changes without a more thorough vetting of them. Those requests went unheeded. In a follow-up call to our partners at REMSA requesting a meeting for the same, we were told there would be no collective meeting with the area fire departments and that these changes were being made unilaterally and would be implemented in short order, essentially requiring the local fire departments to respond and adapt to whatever comes. During the subsequent meeting of the Regional EMS Advisory Board, Reno Fire Department, along with representatives from both Truckee Meadows Fire Protection District and the Sparks Fire Department, raised serious concerns about these changes and requested recommendations from that body to the DBOH through the EMS oversight to facilitate meetings between REMSA and local fire departments, and that did not happen. REMSA has implemented their proposed changes to the regional EMS response model. The results have been predictable. There have been delayed ambulance responses, incorrect dispatch determinants, and disjointed responses to medical emergencies. 2 weeks ago, after these issues began to arise, REMSA, not the EMS oversight, instituted a weekly conference call asking for local fire departments to share with them the problems which we've been having. Reno Fire Department has not provided REMSA with the numerous scenarios encountered because, one, there have been so many aberrations to traditional response models. We're still trying to identify trends and modify our response to them. And two, these issues statutorily fall within the District Board of Health's realm of responsibility. We formally request from the DBOH to formalize an investigation into the changes made, agendize these changes, and the process by which they were unilaterally made. In the interest of public health, we would request these changes be stayed until a meeting with health department representatives and all area responders can be convened to review them and determine what is the best way to proceed. Thank you.
Thank you very much. Okay. Next.
I'm not sure Mr. Dunn still wants to make his public comment, Chair.
No, he
Nope,
deferred his
I'm good.
time.
Thank you.
He deferred his time.
So then we have Chief Charlie Moore from Truckee Meadows Fire.
Chief Moore? Chief Moore, are you there?
Well, it would help if I unmute.
Good job, thank you.
Good afternoon, Mr. Chairman and board members. For the record, I'm Charles Moore, Fire Chief for Truckee Meadows Fire and Rescue. I'd like to speak to the issue of the proposed REMSA response changes, and I'd like to say that I've always enjoyed the ability to discuss issues with Dean Dow, even when they're difficult, and Dean has always been welcoming when we've needed to discuss our respective services. And I want to let you know I've discussed the ILS response issue with Mr. Dow, and we have both committed to continue our meetings and discuss any concerns that we have, and continue this dialogue in this matter with straightforward and professional conversations. So thank you for your time.
Thank you. Any other comments?
No more comments, Chair.
Good, thank you very much. We have come to the end of the meeting. I will adjourn the meeting. We will see you sometime within the next 2 weeks for a special meeting. Thank you all very much.
Thanks, bye-bye.
Bye.
Thanks, everybody.